Visiting a loved one in the hospital is a kind gesture, but you know that staying too long can actually do more harm than good. Let's talk about how to make our visit to the hospital stress-free on both sides. So stress-free for the patient and for the one who is visiting, as well as for the health staff around, and then also make it meaningful, helpful, while not overstaying. Many people think that staying long with a patient means showing more love. But is that really the case? Let's identify a few things that if we consider before we visit the patient is going to help make a lot of difference with our visit time. So the very first thing to keep in mind is we need to know which part of the hospital the patient is. Is the patient someone who has recently had an operation and probably the operation was done around the visiting time? In that case, that patient would just not be available around the time you go. So it's very important to speak with a close relative or caregiver to know where the patient is and to know whether the patient is at a restricted area or not. Once that is sorted out, the next thing is to find out the visiting times. We are very kind to let you know that the visiting times are usually even posted on the doors. But then one general thing to understand is that visiting times are usually in the mornings, maybe an hour to an hour and a half, and then later in the day, maybe an hour to an hour and a half. So you choose which of them is more convenient for you. Now, before you come in, try to also call to find out if there's anything you could do to be of help to the patient. For all you know, helping with some changes of clothing is what will make a difference. Or picking up a lab result on your way to the hospital, or perhaps running some errands when you come around. So it's always good to have an idea of how exactly you could step in to be a blessing around the time you're in. Now, when you come around, would be very glad that at least you speak to the health staff to find out if there's anything they require of the patient and how you could step in. There are certain times that some patients have a lot of visitors, and yet after they leave, there are a lot of things that still ought to be done for the patient. And you wonder, how did this happen? But sometimes it occurred because maybe patient was not aware of what was supposed to be done, or maybe the changes came in a bit late. So please find out and see where you could offer some help. Now, another thing also is that patients are usually very stressed and helpless. They are anxious. So when you come around, do remember to lighten the atmosphere for them. Then, last but not the least, is to remember that if your patient is not on a side ward or the VIP ward, they probably may be sharing the space with other patients. So do well to remember that their privacy is also important. As you keep to making your patient very comfortable, remember to respect the time for visiting and respect the privacy of the other patients. So to recap, remember that as you show love to your patients on admission, 1, plan your visits ahead so that you know whether the area they are is restricted or not and the required time to visit. The next thing is to call to know how you could be of help before you come into their bedside or while you're at their bedside. The other thing is probably to come in with something small and thoughtful. Even if you don't have anything in hand, something to lighten the atmosphere and make your patient or relative feel much better. And then the last thing is respect the time and the privacy of other patients throughout the process. Remember, it's not about how long you stay by the bedside of the patient, but it's about how meaningful your visit is. If you found this video helpful, do share with friends, relatives, and remember to keep it. And do let me know in the comment section which point you found most helpful and may make a difference when you visit your patient. It's bye for now.